The Health Promotion Model by Kimberly Hoffman. After completion of this program, the learner will have a basic introduction of the health promotion model and its purpose, an understanding of the main concepts and propositions, how these concepts and propositions work together to meet the stated purpose of the health promotion model, and I will finish with a basic case study to understand how the health promotion model will work within the family nurse practitioner's practice. The health promotion model was originally created by Nola Pender in 1982 and then revised in 1996 based on changing theoretical perspectives and empirical findings. The purpose of the model is to help nurses discover the determinants of positive healthy behaviors so that they can counsel their patients to help promote healthy behaviors. Pender believed that with the creation of the health promotion model, patients and their healthcare providers would see an increased lifespan, quality of life, and reduced healthcare costs by promoting the healthy behaviors. Pender used the expectancy value theory and the social cognitive theory to form her model. The expectancy value theory believes individuals engage in actions they perceive to be valued and possible outcomes and goals. The social cognitive theory states there is a working relationship between the external factors, such as the environment, and the internal thoughts and attitudes and their behaviors. People must first alter how they think about an action before they can alter how they behave. The beginning of the health promotion model describes individual characteristics and experiences. The two parts of this section include prior related behavior, or how similar behaviors have been dealt with in the past, and personal factors, such as age, race, health behavior, and socioeconomical status. These factors are not likely to be changed or easily modified. The next section is the behavior-specific cognitions and affects. These are the most modifiable, and as a family nurse practitioner, I should focus my questions and assessments to assist in understanding why or why not a change is working or not working for my patients. As a family nurse practitioner, I will be providing the most education within the perceived benefits of action. I need to counsel my patients in whatever methods of learning is appropriate for them to understand the benefits of their healthy behavior. Many people are not aware of the negative consequences to their actions. I must talk with my patients to understand their barriers or perceived obstacles to achieving their behaviors. A strong indicator if the patient will be able to achieve their goal is the patient's perceived self-efficacy, or how confident they are. As a nurse practitioner, I need to do whatever I can to increase their confidence. After the patient and I have implemented a plan, I will work to figure out their feelings and emotions prior to, during, and after, if necessary, to the health behavior. I can assist my patients with interpersonal and situational influences by helping my patients to understand attitudes that they and their social networks have and assist them in finding support from people who have had similar changes. The last part of the health promotion model is the behavioral outcome. Working with the patient, I will need to formulate a plan of action and influence my patients to commit to it. The patient and I will need to find the competing demands, which we have low control over, versus the preferences, which we have higher control over. Please take a moment to pause the video and review the propositions. There are many theoretical propositions to the health promotion model. While I think all propositions are extremely important, as a family nurse practitioner, I believe I will have the most success using numbers 4 through 6, 8 through 11, and 14. With positive beliefs of healthy behavior, self-efficacy, value of behavior, and lack of barriers to work synergistically to strengthen each other. The patient and I will come up with positive experiences and interventions to increase self-efficacy while finding positive social influences such as modeling. The concepts and propositions will work together to achieve Pender's goal of increased lifespan, quality of life, and reduced healthcare costs. At this time, I will be presenting a case study on Jenna, a 31-year-old female with history of obesity and irritable bowel syndrome, and how the health promotion model can be implemented into my practice. Jenna admits she's yo-yoed with her weight several times over the years. Jenna reports in 2005 she weighed 220 pounds. In late 2007, after stopping Depo-Provera and starting to exercise, she lost approximately 80 pounds. In 2010, she gained weight again, topping out at 208 pounds. In 2011, she joined a running group and started running daily, participated in multiple races, including a few half marathons. Jenna states she lost approximately 60 pounds that time. In August 2012, she fell, tearing 3 ligaments in her ankle. Jenna was never your traditional athlete and was never encouraged by her parents to exercise. Her mile times were nothing to write home about, but all other forms of exercise seemed to not interest Jenna. Since then, Jenna has attempted several times to restart running, but for the first year after her fall, her ankle always seemed to hurt. After that, she started increasing her mileage too quickly and ended up having bilateral hip bursitis. Jenna's weight slowly creeped back up, and today Jenna now weighs 212 pounds. She admits she wants to lose weight. She started running again. Jenna does 3 minutes of running, 1 minute of walking, and is following a half marathon trainer. Jenna states she is taking it slow because she doesn't want to get hurt again. Jenna states she does really well running and exercising, generally about 5 to 6 days in a row, but then stops because she had to work 3 12-hour shifts. She becomes lazy and generally stops running for a week or 2 at a time. She states her husband is no help because he states he loves thick women. Her husband is the primary cook for the family and refuses to cook healthy foods, provide portion-controlled meals, or encourage her to live a healthier lifestyle. Jenna states she cannot stand being overweight anymore because she's always out of breath, even with simple tasks like walking up 1 flight of steps to their bedroom. Using the health promotion model as a family nurse practitioner, I would ask what health risks do you think your weight poses to you to assess the perceived susceptibility. I would want to learn more about what Jenna feels towards the perceived barriers of action. She has already stated she works long hours, which leads her to be tired and lazy, and her husband is not supportive. If I needed to elicit further information on barriers to action, I would ask what prevents you from losing weight. Next, I would want to learn more about her self-efficacy. What changed each time to help her to lose weight and stick to an exercise program? Jenna stated she wanted to run again, but had no one to keep her accountable. I would assist and encourage Jenna to find a beginning running group similar to the one she previously had. I could also recommend finding a running buddy that meets a minimum of 2 days a week to hold her accountable. I would encourage Jenna to come up with a list of reasons why it is important for her to lose weight and maintain it. I would encourage her to sit down with her husband and figure out how they can live a healthier lifestyle and support her instead of stating that he's fine with her the way she is, even though she is thick. Next, Jenna could start to learn to cook for herself and eat healthier, following portion-controlled sizes. Lastly, I would encourage Jenna to set a goal and sign up for a race several months out. Having a concrete goal, such as a registered race, will help her to obtain her fitness goals. While not all cases will be as straightforward as Jenna's, everyone needs some form of health promotion. I have always worked in acute care, whether in the ICU, ER, or the cath lab. Most patients I have encountered have preventable medical problems. I think Pender's health promotion model is an excellent model to follow as a family nurse practitioner to truly understand how your patients view a particular health issue, what their barriers will be, and help both the patient and the caregiver to motivate them towards a healthier lifestyle. And these are my references.